All right, welcome back. Thanks for joining us today. Bo and Shaun here again. Today topic, Bo, is the problem with treatment protocols, right? We were talking about this the other day about, I think we had a question from someone asking about what's your go-to protocol for treating XYZ problem. And I think we agreed that the answer was there are no good protocols.
Yeah, for sure. It's one of those things where we know the complexities of pain and, understanding different ages, genders, social factors, psychological factors, hobbies, sports, whatever it may be. There's so many different factors that can influence someone's presenting condition, their rate of recovery, return to sport, return to activity, whatever it may be. There's a lot to consider. And I think if we stick to or went off a specific protocol that you have to be at this stage by this amount of time, it can be far too rigid. I think it's certainly beneficial to have treatment plans and ideas of tissue healing rates and how long things should take, but to have a rigid protocol to follow step by step, I think that's far too simplistic.
Yeah, I think the difference and the key words you used there were plan and protocol, right? The plan is we have to have a plan. If you don't have a plan, you're just flying blind. And so, you just do whatever you feel like on the day and hope that it gets you to where you want to go, but you've got to have that kind of goal-oriented approach to it. And I think that it's a bit of a minefield out there, especially for new therapists who are looking for a recipe. They're looking for a simple answer for complex problems. And we see it everywhere, right? In the marketing, we see on social media and on the internet where people will say, buy this course, the 12 easy steps to solving TMJ pain, or the 5 treatment techniques you need to solve back pain, or here's the technique that will solve all of your ligament injuries. Like, there's nothing like that works, and you'll always come across therapists who will say, oh, look, I use these 3 or 4 techniques for every shoulder problem that comes through the door. And as soon as I hear that, alarm bell goes off in my head. And I think, well, I can list for you 27 different shoulder injuries. You can't tell me that your cookie cutter approach is going to be the right thing for every one of those 27 pathologies. It's just impossible.
Absolutely. And I think that's where you run the risk of falling into a confirmation bias, that whenever someone presents with a certain pathology or a certain type of pain, that this technique works for them every time. Well, you may be getting a result, but is it because of that technique? Is it because of other factors? Did they just get better in time? So there's so many different factors. And yeah, specifically putting a label on, when we look at imaging now or any injury, they're getting more broad and more umbrella terms because we don't really know the primary source of the pain, especially in chronic pain. So it's hard to sort of create a specific protocol for an injury that we don't really know what it is.
That's right. And you also touched on a key point. There's people often just get better anyway. And what we know, understanding mechanisms behind manual therapy and exercises, you can do almost anything to a human body if it's done with the right intention, in the right setting, with the right approach, and you'll get a reduction in pain or an improvement in symptoms in one way or another. So if you apply your cookie cutter template approach to shoulder injury number 23 and shoulder injury number 12, well, then there's a pretty good chance that you'll have a reduction in pain for both people. But is that the best approach for that person? Will it just reduce the pain and improve some of their symptoms? Or is there maybe a better approach that's tailored to that person that will reduce their pain to 0 and improve them faster and further? Like, there's, some result is different to the best result. And the only way to get the best result is to consider that whole picture for the person.
For sure. And that's where being a coach, when you treat someone for the first time, you might do a small amount of treatment, see how they respond. If you said, well, we need to be here by next week, and they don't get there, well, they're going to feel disempowered. They're going to feel like they're failing. That affects their overall well-being, their psychology, and their mood. So it's really about seeing how they respond the next session, and then increasing your dosage with your treatment, your exercise intervention, whatever it may be, or decreasing it depending on how they respond. So it's sort of like you'll have this plan of where you want to get to based on the patient's goals and their preferences, and then creating this plan to move forward. But we need to tweak that along the way, and that will be progression and regression, but always checking in with that patient to see how they're going. Because I think if we said, well, in 8 weeks, you need to be here, and they don't get there, then again, as I said before, that can be quite disempowering. And we really need to identify what is stopping them from progressing. Is that plan that we've given them right for that particular person? Does it consider all other variables? Their lifestyle, the activities that they're doing, their work, genetic factors, a range of different things. Are they able to participate in the exercises that you've given them? Or what's stopping them? Is it a time factor? Do they enjoy the exercises? Do they have the available equipment? So there's so many different factors. It's all well and good for us to say, this is a strict strategy. This is the way that your tissue is going to heal. Well, if that was the way, then, we would fix everyone in a 4 to 6 week period. It's especially when we start to look at chronic pain, it's so different to treating an acute injury. So let's say if you've had an acute hamstring injury, a grade 1 tear, there's a pretty good chance you're going to be back in playing within 4 weeks. But we know that tissue healing isn't the same, doesn't work the same in chronic pain.
Absolutely. And a lot of those chronic pain symptoms that people have aren't actually related to the tissue damage itself. There's other neurological processes that have taken place that are perpetuating their symptoms, or psychological problems that are taking place perpetuating their symptoms. So it's not just that tissue. And this is where, like, setting someone a specific timeline for healing and that recipe approach to treatment, it does. You're right. It sets them up for disappointment a lot of the times if you don't consider those other things. The other thing I think we would consider too is that tissues can become injured by different mechanisms, with different mechanisms of injury. So, for example, someone presents with bursitis, and maybe your lecturer or your textbook or something says, when you see a bursitis, you should treat it X, Y, Z, 1, 2, 3 steps, whatever it might be. But what if the bursitis was sustained by a blunt force trauma versus a tendon rubbing against it, versus compression? But there's various different types of mechanisms that can lead to a bursa being irritated. And so if you apply your manual therapy techniques to the bursitis, they go, right, okay, it's a pes anserine bursitis. I'm going to treat those 3 muscles that have tendons that cross over that bursa. I'm going to address those soft tissues, take tension out of them. That will unload the tendons, decompress the bursa, reduce the irritation. There's my solution. But if they had that pes anserine bursitis because they whacked their knee against the coffee table, then there's no amount of soft tissue work on those muscles that's going to change their symptoms. You have a traumatic injury that needs to be addressed in a different way. And so, yeah, treatment protocols, this is the biggest challenge. There's all these other factors, the mechanisms of injury, the psychosocial factors, the tissue health, the systemic health of the person. Are they a smoker? Do they drink too much? Are they overweight? What's their systemic health like? How will that impact the timeline of healing? The psychology, do they want to get better, or were they injured at work and they really hate their job? That's a big one. I know exactly how to get you better, but maybe they're not really motivated to get better in a hurry because they don't want to go back to work so quick. Like, these are factors we have to consider. And so I think it's a big minefield for anyone who thinks that there's going to be a recipe to follow for any injury. I think you sort of touched on a couple of key points there, which is understand how tissues heal, understand the expected timeline for recovery, consider the whole person, the psychosocial factors, all the other inputs that they might have, overlay those over the top of one another, and then come up with a protocol, if you want to use that word, that's tailored to that person. It's like getting a suit made just for you. You can't buy a perfect suit off the rack. You have to get it cut to you, right? So the treatment's got to be similar in that way as well.
Yeah, that's key. If it's a protocol, it's a protocol individualized for that person, but that needs to be a flexible plan. Where you might look at, say, an acute lumbar injury, a lumbar disc injury, it's useful to know timeframes so that we can tell that to a patient to say, look, this is probably going to take at least 3 months, but in most cases, it's quite a good prognosis, and lower back injuries most of the time get better within 3 months. There's exceptions to that, and there's other factors that are involved, but giving a patient an idea of how long things will generally take, that it's not going to be an overnight fix. That's a great start to sort of educate them on what's going on, how long it's going to take. This is the steps that we need to do to get there. You are going to have some bad days. You are going to have some bad weeks. But if you look at that month as a whole, well, this month will be slightly better than last month, and the next month will be slightly better than the month before. So overall, having this broad picture that over time they're going to get gradually better. They can't expect to have this huge spike and be instantly better. And you as the therapist need to be the coach, to just tweak things and guide them along the way, not do all of their recovery for them, because that's just not what's going to happen. You need to provide the treatment, the advice to assist them to take ownership, take control, and help their own improvement.
Yeah, and I think a key aspect of that too is also assessment. Like we talk so much about, all right, you've got an injury. What do I need? What are my inputs to you to help move you away from the injury towards, healing, towards health? But we forget that, it's like you're driving down a highway and you need to turn at a particular road. Well, the only way you're going to know where that road is if you're measuring where you are in space. Like, that you're passing through this town. Okay, this road is beyond that. So those landmarks down the road are the assessment measures that you put in place in your treatment plan. And so if you are taking someone from a grade 1 or grade 3 hamstring strain right through to recovery, you need to know what to look for along the way, firstly, to see if you're making progress. And secondly, to know what else you might need to do if things aren't progressing as well as they should. The other added bonus, of course, is that when you provide ongoing assessment, as in conduct ongoing assessment and gather data as you're going, you can take that data and you can feed it back to the patient and say, look, remember when you came in 3 weeks ago? Here's what your presenting symptoms were. I know that you're still suffering with some discomfort and some range of motion problems now, but here's actually where you are now. Can you see the difference? And they might not have recognized that they've improved by X range of motion, reduction in pain to a certain rating scale, whatever it might be. But if you've tracked that over time, you can reinforce that progress for them. And they can use that as something to sort of hang their hat on and go, look, I actually am making progress. I didn't notice. Like, I'm still feeling some pain. Therefore, I feel like I'm not getting anywhere. But it may be half of what they started with. They just don't have that context. So measuring progressively, feeding that back to the patient and using that as a guide as to where you're going next.
Yeah, 100%. Those measurable outcome-based goals, having a subjective assessment, subjective goals as well. Because, and I've experienced that as well, where you'll treat patients and you might do a strength assessment or even as simple as a verbal or visual analog scale, and they might say, oh, I'm at about a 4 out of 10, but the pain's not as frequent, it's not as intense, it doesn't last as long. But initially when you came in, you couldn't get to sleep at night, it was stopping you from working, you weren't participating in sport. So they might still have some symptoms, but the severity has changed. So it's really about settling down not only what's happening as far as the tissue injury, but the nervous system. So understanding how the body will respond over time, and then giving that positive feedback back to the patient to say, look, you're doing a really great job. Hang in there. This will get better. We've just got to keep along this path. We might increase your exercises or have a look at any other variables that we can play with.
Yeah, you're right. And it's disappointing, I guess, for the person who was maybe looking for a recipe, for a cookie cutter approach to solving all of the different musculoskeletal or whatever conditions that walk through their door. But, for the person who doesn't have the answers but was looking for that answer, maybe the solution is actually, okay, go and study pathology. pathophysiology, probably a better way to put it. Understand how tissues behave when they are injured, damaged, when there's some pathology process taking place, so that you can understand what that trajectory looks like. What does the etiology look like? Understand physiology at a greater level, so that you can understand what healthy tissue looks like and how it behaves in systems that involve those tissues. And then when you combine those two pieces of knowledge and something goes wrong, well, you can kind of see that you'll find clues as to how you can come out of that negative situation towards a more positive one. And, you know, if you understand, and this is, I guess, the mark of someone who's kind of got the answers, if you can try to pull all those things together and understand, all right, I understand how this particular injury, I understand how it should behave when it's healthy. And then, okay, what are my treatment options? You don't have to have every modality in your toolkit. You don't have to have every assessment technique in your toolkit. The successful therapist is going to be able to take what they've got and specifically select the techniques that they have that will be useful for that person. You don't have to go off and do some specialist course in, you know, shoulder pathologies or hip pathologies or something like that that teaches you a specific trademarked approach to something. There's always someone out there looking to make some money off you. It's just about understanding your mechanisms within your manual therapies, mechanisms within exercise, and then how you can apply those to basically anything that comes through the door. You can produce a beneficial effect with just about any pathology in one way or another if you understand how to apply it to that specific pathophysiological state.
For sure. And then, you know, not only applying a technique based on your understanding, it's applying that knowledge or providing that knowledge in form of education to the patient, because just educating them on what's going on, why it's painful, why it may be a little bit worse this week, that can really de-threaten, reassure the patient, and just in that alone can have a therapeutic response. Yeah. Knowledge is power. The more knowledge that you can give to a patient about what's going on, that can really reduce their fear, their anxiety, and we can use that to then get them moving, get them active, and, you know, back onto that road to improvement. So, sure. Understanding pathology and how injuries and pain tends to behave is huge.
You hit the nail on the head there. I reckon, from a personal experience point of view, in more recent years, I've intentionally spent more time with patients just explaining their injury or their presentation to them, and helping them understand why it's behaving the way it is, and then what they can expect it to do in time if they do this or if they don't do this. And I think the sessions where I've spent more time talking and maybe got to the end and thought, oh, you know, they're probably going to be disappointed we didn't do as much treatment, I've always been surprised how satisfied the patient is at the end of those treatments, well above what I expected, because I think the power of that education, I think you're right. You know, it's just we who are used to doing treatment all the time, you know, hands-on patients, assume, probably wrongly a lot of the time, that our patients want that and only that from us. But if you give them what they need sometimes, which is a better understanding of their situation, it empowers them to be able to take better control of it. And that in itself is therapeutic. You know, that confidence they have, like, now I get it. Now I understand that when I jump out of bed in the morning and go running straight away, rather than warming up first, that's why my pain is worse than after I've moved around a bit, or, you know, whatever is relevant to their particular injury. But that education around their situation is empowering. It's therapeutic in that confidence reduces pain through the catastrophization of pain. And so all of these things are useful. So, I think the advice we probably give to everyone is, don't be afraid to just spend a little bit more time explaining the problem to the patient. If that takes away from your treatment time, just consider for a fact that the education is part of the treatment.
I completely agree. If you say you've got an hour, and I've done this a lot with my students, say, look, it's an hour of your time. It doesn't mean that it's an hour hands-on, because your time, your experience, your understanding, your education, that is treatment. You know, the way that we can communicate, build trust, build rapport. If you don't have those things before you lay your hands on someone, then you're probably not going to get a good result anyway. So it's really about spending that time to educate the patient, build confidence in their body, build confidence in you as a therapist, and then, you know, spend some time going through some movement, some exercise, make them comfortable with that movement after you've applied a treatment, because you've reduced their pain with your hands-on techniques. You need to show them that it's okay to move. And then one of my biggest tips would be follow that patient up. Don't wait, a week or two until they come back and see you again. Follow them up a day or two later and say, hey, how'd you pull up after that treatment? Especially if it's a fairly new patient that you haven't seen much before. You don't really know how they're going to respond to that treatment, because you might have done a little bit too much and flared them up, and they haven't gone ahead with any of their exercises, and they're feeling pretty defeated that, now I feel a bit worse. Or if they're saying, yeah, feeling great, excellent. Can we get you to do a little bit more of those movements, those exercises, that self-mobility? So you're sort of coaching them along the way rather than, leaving a huge gap in between treatment. Imagine if your doctor gave you a call the following day, how good that would feel. Oh, they really care. Not only that, it's really making sure that they stay on track and stay more accountable to the advice that you've given them as well.
Yeah, no, that's it. But Bo, I think that's a really good point. I guess that reinforces what we were saying before about assessment. You won't know how well your treatment has gone unless you check in with them. You might see them a week later, but most benefits that we get from a manual therapy treatment will wane within that week. They'll disappear or they'll fade, especially if the inputs that cause their injury are still there, like the load that's on the body or the mechanisms at play. So checking in that 24, 48, 72 hours after gives you a really good idea about what's actually been the fallout from the treatment. Has it been a positive or a negative one? Has it been a neutral one? And then you can tweak your treatment. Then you can even tweak your assessment processes to be more specific as you go forward and target that data that you actually want to capture. So I think we've covered a few things there, but that's good.
Yeah, but it will improve your experience as well. You might have someone presenting with an acute neuropathy, and you think, oh, yeah, they're much worse. Well, okay, now I know that next time a patient presents like that, I probably need to do much less. Maybe shorter treatment. So yeah, it really helps to build your clinical experience as well.
Yeah. All right. So I guess the advice we've got for anyone who's looking for a clinical protocol or a treatment plan that is pre-designed for a particular presentation is don't. There's no cookie cutter approach to anything. It really just comes down to knowing that human body really well, knowing your injuries, and then understanding what tools you've got in the toolkit and how they actually work so that you can be really selective in the way that you apply them. I think that's it. Definitely. Anything else to add?
Plenty, but not for today.
Okay, we'll save that for another chat. Nice one. All right, thanks, Bo. That was great. Talk to you soon.